what does Hahnemann say about psychiatric cases? Hahnemann primarily has written that most of the psychiatric cases are not purely psychiatric. In fact, Hahnemann was very, very sure that most of these psychiatric ailments begin at the physical plane. They begin at the corporeal plane, which is the word that Hahnemann has used. Corpus means body. So Hahnemann has written that most of these psychiatric ailments begin at the corporeal plane, but as time passes, couple of months, couple of years, it can be, the physical symptoms, they become less intense, and the psychiatric symptoms, the mental symptoms, they tend to become more and more intense in certain patients. And at some point of time, the mental symptoms become so intense that the physical symptoms are not perceptible. And at that point of time, the patient and the attendants and the doctors feel that this psychiatric ailment, this so-called psychiatric ailment, is purely psychiatric, and that it's a one-sided disease. And here Hahnemann cautions us that when you are treating a psychiatric case, do not treat it as primarily psychiatric. Look at any physical cause that could have occurred, or any physical symptoms in the history, or any physical ailment in the patient's history. Do not ignore that physical history, even in purely psychiatric cases. Even if you have a case of OCD or schizophrenia, don't ignore that those symptoms which are which are probably not there now. But if you take the case well, you will probably find that couple of years later, patient had certain physical symptoms.